In 2021, over 38 million people in the United States had diabetes, which is about 11.6% of the population. The percentage of adults with diabetes increased with age, reaching 29% among those 65 years or older. In this video, we'll explore how care management can help monitor, treat, and support patients with diabetes. Hey, this is JP from ThoroughCare. Here at ThoroughCare, our platform helps practices manage, bill, and streamline reimbursements for care management programs like chronic care management and remote patient monitoring. Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. High blood glucose can cause other health problems over time, such as heart disease, nerve damage, vision loss, and kidney disease. The most common types of diabetes are type 1, type 2, and gestational. While there is no cure for diabetes, there are many ways to improve and manage it. Regulating diabetes involves monitoring blood glucose levels, taking medication, following a healthy diet, and reducing stress. If you're thinking that's a lot for a person to manage on their own, you're not wrong. That's why enrolling these patients in programs like chronic care management and remote patient monitoring can be so beneficial. Not only will patients get personalized care and support, but they'll also become more engaged and able to take better control of their health. Now let's use an example patient to show the benefits of care management programs for those who suffer from diabetes. Meet Mary. Mary is a 75-year-old female with type 2 diabetes. She is having difficulty managing her condition and is worried about the increased risk of infection and stroke. During an annual wellness visit, Mary's provider enrolls her in several care management programs, including chronic care management or CCM. Once enrolled in CCM, Mary's designated care manager works on creating a care plan that customizes interventions and treatment strategies to address her specific needs. For diabetes, this could include monitoring blood sugar levels, conducting insulin therapy, and determining the right combination of medications. Next is suggesting lifestyle modifications. Care managers work with Mary to make healthy lifestyle changes, such as adjusting her diet, regular exercise, stress management techniques, and smoking cessation. In a CCM program, care managers facilitate communication between various healthcare providers involved in Mary's care. This ensures a cohesive approach and reduces the likelihood of care gaps or duplications. Perhaps one of the most important benefits of a chronic care management program is patient education. With the help of her care team, Mary learns about diabetes, its causes, risk factors, and the importance of treatment adherence. This education empowers her to take an active role in managing her health, removing guesswork and self-doubt. Since CCM is a monthly program, Mary will have recurring touchpoints with her care team. As her circumstances change, her care manager will remain up to date and can modify her care plan as needed. Along with CCM, enrolling Mary in a remote patient monitoring program, or RPM, can help Mary manage her diabetes. RPM uses technology to collect and transmit health data from patients to their healthcare providers. For diabetes management, this means using devices that track glucose levels, medication adherence, and other relevant metrics. The best part is, Mary can use the device in the comfort of her own home. With real-time monitoring, providers can identify trends and patterns in her glucose levels, allowing for timely adjustments to her treatment plan. Some RPM devices that are used to help manage diabetes include smart glucose meters, blood pressure monitors, and step counters. Many RPM platforms provide educational resources and personalized feedback based on the data collected. As we mentioned earlier, patients can be enrolled in CCM and RPM at the same time. This makes for a more holistic view of the patient's health, ultimately leading to better outcomes and higher reimbursement. Another program that can play an important role in managing diabetes is Behavioral Health Integration, or BHI. The mental factors of chronic conditions are often overlooked. Patients with diabetes can feel discouraged, worried, frustrated, or tired of dealing with daily diabetes care. Those overwhelming feelings, known as diabetes distress, can cause a patient to stop taking care of themselves. A behavioral health condition can be diagnosed during a mental health screening or when creating a patient's care plan. The next step would be to enroll the patient in behavioral health integration. BHI involves techniques like mindfulness, relaxation exercises, and cognitive behavioral therapy to help patients manage stress. Reducing stress levels can lower the risk of developing complications from diabetes and help with blood pressure management. Effective communication and coordination between programs is crucial to realizing these benefits. Healthcare providers must ensure that the various programs are aligned and that the patient's care is seamlessly integrated. If you're interested in learning more about care management, you can find information on our website. To learn about how ThoroughCare can help set up and manage your own preventative health programs, please reach out using the link below. Please click like and subscribe. Thanks for watching.